everyone. Sorry, there was just a temporary pause while I was no longer the host for a second. So as you'll see in the chat on the side, that's going to be where you can send questions. My name is Kelsey Erickson. I am the Safe Sport Director and Anti-Doping Director at USA Cycling. So first of all, we're thankful for all of you that are here. We're probably going to have a few more people kind of jumping in as we go. But I'll just set it up with a little bit of information about Zoom before we get started. I currently have you all on mute, and I want to keep it that way because otherwise it jumps around and it's really difficult to follow. When you have questions, if you can just put them into the column on the right, there should be an icon at the bottom of your screen that says chat. You can click on that, you can post questions there. And then I will go ahead and be managing those questions as Dr. Roshon shares. And at the end, I will pose questions to him and we'll have a group discussion around those, or a group answer, I guess, more so than discussion. If there's questions that are really specific, I will probably take those offline and we'll address those after. If there's questions that are more group-based, then we'll go ahead and address those with everybody online. So if you're not sure about how to ask the question, you can go ahead and ask on the, well, you'll be able to figure it out on the side. It's pretty straightforward, but I'll be managing those. So don't panic if nothing is answered right away. We'll do that at the end. For some of you, you will have seen the video that we posted on Friday, where Dr. Roshon gave us an initial kind of update and insights into the coronavirus. Today is essentially an opportunity for us to do a follow-up. He's going to give us some updates on, things that have happened over the weekend, how things have progressed, and kind of where we stand now. And then, as we mentioned, there will be an opportunity to ask and answer questions. Just so you know, this is being recorded, so we're probably not able to get everyone on this call, but we will have it recorded and we will be posting it later. If you're not able to get all your questions asked today, the same will apply, where you can email me and I will be in communication with Dr. Roshon and we'll be able to answer questions off channel as well. So don't panic if you're not able to get everything covered in this session right now. And we'll be looking to do follow-up sessions as well. Surprise, Dr. Roshon. But yeah, so just know that that will be coming. So yeah, without further ado, I'm just going to very briefly introduce Dr. Roshon for those who may not have got the intro on Friday. He specializes in emergency medicine. He has been a doctor with multiple professional cycling teams. He has over 22 years of experience in the medical field, and he is currently the chief of medical staff for the Penrose Hospital System here in Colorado Springs. And he's part of their COVID-19 task force, so he's very much up to date on this. And he also has his PhD in microbiology and immunology, so this is very much in his area of expertise. And so we're very lucky and grateful to have him being willing to talk to our community. So without further ado, I am going to hand it over to Dr. Roshon. And as I said, if you have questions, please, as the session is going on, just send them into the chat box and I will be managing those. So I'm going to go ahead and mute myself and unmute Dr. Roshon.
Okay. Hi, everyone. I hope you can hear me. Thanks for unmuting me, Kelsey. So thanks for that great introduction. I do have a little bit of expertise in virology, but I never thought that it would be needed to be used like this. So what I thought I would do is just start with a little bit of an introduction, sort of go through, what the situation is right now, and specifically how it applies to athletes, and then we'll open up to questions at the end. I want you to know this is a very rapidly changing situation, and no one really knows everything about this for sure. So this is a situation that's guaranteed to make anyone who tries to make some predictions look like an idiot, but I'm okay with that. So while these predictions and the things we talk about may not always turn out to be entirely true, my hope is that they can still be useful. So I want to start with the basics, look at the responses that we can take to try to control this virus, and things that we should think about now, and knowing that things can change. I do want to start by saying that there is a cause for concern with this virus, but there is not a reason to panic. The main distinction there, I think, is that there are things we can do to protect ourselves and to protect our athletes. And so let's make sure we know what those are and that we're doing them. If we do that, then there should be no reason for panic. It is definitely a cause for concern. Let me start with some basics about this virus and why it's different than some other things we have faced in the past. Look, there's nothing new about having a coronavirus that infects humans. There are a number of coronaviruses that have been out there. They cause usually nothing more than a mild upper respiratory infection, and you've probably had one in the past. This started to get real in about 2003 when the SARS-CoV-1 virus, that was the original SARS virus, came out in 2003, and it caused really severe lung disease and a very high mortality rate. That was something that we hadn't seen before that we knew of. And then again in 2012, another coronavirus came out called the MERS virus, and that caused a lot of disease as well. So 2003 and 2012, we had these sort of pandemics that came out. And then at the end of 2019 is when the SARS-CoV-2 virus, that's the virus that causes the COVID-19 disease, came out. It is very, very similar to the original SARS virus. It turns out that it's not as deadly. The mortality rate for patients infected with this SARS-CoV-2 virus is not as high as the original SARS, but it is much more easily spread, and that's where the danger comes. And when we look at how that is getting spread, and compare it to some viruses that we are familiar with, you can really start to get a sense of why this has spread so fast. So there's a thing in virology called the replication number, or we call it the R0, which tells you how many people are likely to get infected if there's one infected patient. How many people will that person infect? With influenza, that number is about 1.3 to 1.5. And that's why influenza tends to spread every year. If you can get that R0, that replication number, down to below 1, then usually the epidemic will die out and it won't spread worldwide. The replication number for the SARS COVID-19 disease virus is about 2.2 to 2.5 on average. What that tells us is if you take no actions, this will spread and it will spread quickly. And there's a couple of other things about this virus that make it have that replication number or spread so quickly. The first thing is that there seems to be a lot of people that are very asymptomatic. They have an asymptomatic period where they get the disease, they're able to shed the virus, but they don't really even know that they're sick. And that can last for a few days. So those people can infect people while that's happening. There are also some people, like especially kids, that seem to get the virus and they never really get any symptoms, but they're still able to spread the virus. So those things are combining. Combine that with the fact that nobody in the community has any immunity to this virus, so that it's not like a virus that's been around for a long time and some percentage of people will be immune. In this case, nobody is immune to this virus, so that's why it's spreading quickly. It is not as bad as other viruses. So it spreads more easily than, say, influenza, but not as bad as some other viruses that we know a lot about, like chickenpox or measles. If you haven't had chickenpox and you're in the room with somebody who has chickenpox and you're 20 feet away from them, you're going to get it. So this virus spreads fast, but it's by no means the worst, fastest spreading virus that we know of. The other thing I want to say about this replication number, this idea that this is why the virus spreads so fast, is that is not a feature that is intrinsic to the virus. So it really is about the combination of the virus and how we respond to it. So it is something that we can modify. And so if you look on average, it's about 2.2 to 2.5, but on the Diamond Princess cruise ship, that number was 15, which puts it up closer to the measles level. So that means for every one person who was infected, they infected another 15 other people. And there was this Biogen conference in Boston that the replication number seems to be much higher than on average too. So the combination of the virus and how we respond to it and the environment that we're in is really what leads to the fast spread. And that's our best option to control the virus at this point. So that gets us to sort of the question of how is this spread? And there's a lot of controversy about this. It seems to be very clear that it is a combination of contact and droplet spread. It doesn't seem to be very well spread by just simply the air. So contact and droplet. And that really helped us understand how we can stop it. There was a paper that just came out a couple days ago that has already begun to study how long this virus can last on a surface. And it looks like it can last for up to 72 hours on a metal or a plastic surface. So that means somebody coughs, that droplet lands on a desk, you touch the desk sometime in the next 2 or 3 days, and then touch your face. That's how you can get the virus. It's not so much just being in the room with someone who has it, it's that touching contact precaution or droplet precaution. So that really informs how we think we can protect ourselves. And the first key thing is distance. If you're more than 6 feet away from a patient who has this, you're probably in the safe zone. Anything within 6 feet, you're at risk for getting a droplet, and you would want to be doing something, either have a mask on that person or have a mask on you so that you're not getting exposed to those droplets. Since it lasts so long on surfaces, you want to be really cautious about cleaning your hands after you touch anything. And you can do that with, soap and water for 20 seconds, or you can do it with these alcohol-based cleaning lotions. They seem to work really well to inactivate this virus. So cleaning your hands is really key. If you are going to be around someone and you think you're going to be at risk for being within 6 feet, I would recommend you wear just a plain old surgical mask. You don't need a respirator type mask, just a plain old surgical mask to prevent the droplets from getting anywhere near your airway so that they could get into your lungs. And honestly, one of the biggest things that the mask does is it reminds you not to touch your face. It's a little bit of a barrier there so you don't touch your face. That is how we think this virus is getting spread most. So distance, good hand washing habits, wear a mask if you need to be close to somebody, but mostly don't touch your face. And that really comes in when we're talking about travel. So if you think about the things that we're exposed to where you can't always get 6 feet away from someone, travel is probably one of the more common things that we do. If you're sitting on a plane with somebody, you're within 6 feet of sometimes 8 or 10 people. And so you need to be cautious about that. I know everybody's heard a lot about the travel bans and everything. I'm just going to say, I think that that's a smart thing to do. I think that you should probably not be traveling if it's not absolutely critical for what you're doing. And you certainly shouldn't be traveling to any place that has widespread community spread of this virus. And so let's talk about where those places are right now. It's obviously China, Korea, Iran, Italy. Those are places where we know there's sustained community spread. You would not want to travel to those places unless you absolutely had to. Within the US, the CDC is not banning travel. They don't typically give domestic travel warnings, but I'll say large cities in California are having a lot of community spread, and Seattle, of course, and definitely New York. So you'd want to be very cautious. You want to have a really good reason why you were traveling to those places. And right now, we think travel is probably one of the biggest reasons that this is spreading so fast. So the next question is, look, if we ban travel, if we use these ways to protect ourselves with masks and distance and hand cleaning, does it make an effect? And the answer is a resounding yes, it does make an effect. If you look at how many cases they had in the original city in Wuhan, it was unbelievable. They ended up with over 20,000 hospitalizations. Meanwhile, another city, Guangzhou in China, where they made these rapid interventions, put people on social distancing, travel bans, et cetera, exact same virus caused less than 500 people to be hospitalized. So we know that through a series of testing and using these common sense approaches, including reducing mass gatherings, reducing travel, we can significantly improve or reduce the spread. So that is key. All right, let's talk a little bit about athletes specifically and what I think our athletes should be doing and how we should be advising them. The first thing I think is I think it's okay to keep training. If sometimes these pandemics can really turn off pretty quickly. And what you don't want to do is say, yeah, the races have been canceled for a couple of weeks, but then when they start getting turned back on, now you're not ready because you haven't been training. Training is probably completely safe. You're outside with high UV. You are, if you're by yourself, you're very unlikely to get COVID-19 from riding outside. And so I think keep training. A question that's come up is should we be doing group rides? I want to just sort of talk about that and give you sort of 3 ways you could think about it. By far the most safe thing to do is to quarantine, stay in your basement, and not do a whole lot of training. And so that is the most safe thing to do. But in many ways, I think it's probably unnecessary. As long as you're maintaining social distance and doing good hand hygiene and staying away from sick people, you are probably safe. So I think it's reasonable to say ride outside either by yourself or in a small group, people that you know really well, people that you know have no symptoms, people that you know have not traveled to a dangerous area. And I think that's a reasonable thing to do. You could probably ride in a group of 3 or 4 people that you know well and have no risk of exposure to the virus. I would not recommend riding in a large group of people that you don't know and you don't know their travel history and you don't know what their symptoms are. So again, most safe thing to do is to self-quarantine and not ride outside. I don't think that's entirely reasonable. I think it's a reasonable thing to do is ride in small groups of people that you know. And then the next thing is, how should you handle travel? I think many of these races are now being canceled. I think that's the right thing to do. When you're having a bunch of people travel from all over the place to go there, you really are. It's impossible to self-quarantine and maintain social distance in a large race with people staying in the same hotel, people traveling on planes to get there. I think you need to be really certain that any travel that you do is really mission critical, and if you don't need to do it, don't do it. That's probably your biggest risk of exposure that you can't control. The other thing I want to say for athletes is I've heard from a lot of people that, oh, it's just a mild disease, it doesn't matter. Why are people canceling these races when it's just like a cold virus or it's just like the flu? We get the flu every year. So I want to address that head on, and I hope I can convince you that you want to put off getting this disease for as long as you can. So it is true that many people get a mild disease. The overall mortality rate for young people is very low. If you're healthy, there's no reason to panic. You're probably not going to get very sick from this thing. But there's a couple of things that I think you should really think about before you put yourself in a dangerous situation. One is this virus enters through the lungs. It attaches to very specific receptors that are on the lungs and the heart and also in the intestine. And it's causing a severe amount of lung disease. We're seeing people that have, from the original SARS outbreak back in 2003, had lung symptoms for years and years and still have it. We don't know what it's going to do to athletes, but there is a reason to predict that some athletes might have prolonged lung symptoms that maybe a regular person that, their idea of exercise is walk into the mailbox. They may never notice it, but if you're trying to be a competitive endurance athlete, you definitely would notice it. You don't want to get this virus. It's going to affect your ability to train and to compete. And so try not to get it. The other thing is, if you can put off getting this virus, there are a lot of things that could happen in the next 12 to 18 months. New treatments, vaccine options, all of these things are in the work now. It is very reasonable to say, while some people are predicting that this virus is going to spread and infect most people, if you can delay that spread and you can put off getting it until there's vaccine options or treatment options, you could have a much better time of it. So I would say be cautious. This is a time to really think about how to prevent getting this virus. That's the best thing that you can do. Other than that, what can we do to be our best and to limit any disease that we could get from this? And again, when you look at the way this virus works, the main problem that it causes is by directly infecting these cells in the lungs, and it causes direct viral damage to those lung cells. That is different than some viruses. In some viruses, the immune response to the virus is what causes most of the symptoms and most of the disease. Influenza is often like that. In this case, that doesn't seem to be the case. The virus itself is going in, and when it infects those cells and is uncontrolled, it causes a lot of direct damage to those cells. What that means is you want your immune system to be the best it can be to try to control that spread initially. So what can we do, and what can we tell our athletes to do that? The first thing is sleep. You want your immune system to be the best it can be to fight this virus. And if you're not getting enough sleep, that definitely has immune effects. So try to get your good 8-9 hours of sleep at night if you can. I know it's stressful and people are fretting, but still try to make sure you make time for sleep. Second thing is diet. A good, clean, healthy diet is the best. This is not the best time to be starving yourself, trying to lose weight, doing prolonged fasting, etc. Those can reduce your immune response, and I think you need your immune response to be the best you can for this. I think you should exercise. That has some proven benefits, but not too much. This is not a time to be doing, absolutely killer intervals and super high volume training where you're getting your immune system knocked down a little bit. Again, we want our immune system to be the best it can be. And again, I'll put in another pitch. The best thing you can do is prevention. The best thing you can do is the social distancing, the hand hygiene. Try not to get this virus. It's the best thing you can do. Okay, that's my little spiel. And again, I am available to answer questions either on this call or later. I think the best thing to do if you don't get your question answered here on this call is reach out to Kelsey Erickson via email, and she can collate these things, and we can make sure that we answer them either through another webinar, or I can reach out to you directly. I'm happy to help. All right, Kelsey, you got some questions for me?
Yes, thank you very much, Dr. Roshon. I have a number of questions, and I imagine a few more will come in. So they're going to be out of order, so don't panic, people, if I'm doing them in the wrong order. But a lot of them are around, there's quite a few around the idea of group rides. And so you touched on the idea of keeping it very, very small. One of the questions, some of the questions are kind of alongside that of like, if someone's riding and they are passing somebody going the other direction, is it possible to transmit or catch a droplet from someone else if you're going in opposite directions?
I think that is incredibly low risk. You're outside, and you're usually going to be more than 3 feet away, which is the true danger zone, is within 3 feet. We say 6 feet, but look, you can come up with doomsday scenarios where things could happen, but honestly, I think that is really, really low risk.
Okay, thank you. One of the questions was, why has USA Cycling made the recommendation to not do group rides? I think we've already answered that. Another question was around, if they are riding with somebody else, is there potentially a safe distance or speed at which they should be trying to manage next to that other person?
Yeah, it's hard to say go for a group ride, but stay 6 feet away from somebody. You could do that, but again, if you have reason to believe that the person you're riding with doesn't have the virus, and you've been pretty careful, right now there's pretty minimal. Again, if I was in Seattle, where there's a lot of sustained community spread, I don't know if I would trust that, but here in Colorado or in most places that don't have a lot of community spread, I think you're pretty safe to do that. Naturally, if you wanted to be most safe, you would ride more than 6 feet away and make sure that you weren't doing things that spread droplets, like blowing your nose. And you can easily just say, hey man, I'm gonna spit, let me get in the back, and then that way you're not blowing your droplets all over somebody else, which is kind of gross even when there's no virus going around, right?
Awesome. Another thing maybe just to touch on is so it's been commented around the idea of like not also just being conscious of going outside, the fact that you could get injured, end up in the ER, and you're potentially taking away the medical personnel's ability to treat somebody else that might need to be treated for the virus. Is that something to consider?
Yeah, again, I think it's something to consider. You know, as you know, the vast majority of the time you go out for a ride, nobody ends up in the ER. So I don't think you have to be panicky. I think be smart, ride safe, don't end up in the ER. That's a general a general good way to live. I don't think this is any different than regular, as long as you're taking all the normal precautions.
Thank you. And what about, another question is, if someone has potentially been exposed to the virus, should they refrain from biking outside because they might transmit it to somebody else?
Absolutely. If you think you've been exposed, or if you're having any symptoms, you need to self-quarantine. You need to stay home. So for instance, here's what we're doing for people in the hospital. If I get exposed to someone that we think has it, then I'm home for 2 weeks, right? I'm in my basement. I'm away from my family. I'm being very cautious. If I don't have symptoms in those 2 weeks, then I probably don't have the virus, and I'm good to go. I would do the same thing. So if you get exposed to someone, let's say someone says, I'm worried, I have a fever, I went in and got the test done. It's going to take sometimes 4 to 8 days to get that test back. If you were exposed to that person, I would go on self quarantine, not ride outside, not go to the grocery store, et cetera, until you hear that their test is negative. And if it is positive, then you've got a full 2 weeks to make sure you don't develop symptoms.
Awesome. Another question is, can it be transmitted through sweat droplets?
No.
That answers that one. What about any advice that you would have for cyclists that are living in areas where they're being told to essentially shelter in place?
I would shelter in place. If I was in, Sacramento, Seattle, parts of New York, places where there's widespread community spread. Here's one thing you have to know is when you've got, 100 people in the hospital and a bunch of them sick, you've got thousands and thousands of cases in the community. In that case, I would stay home. I'd ride my trainer. I would not go out. The best thing you can do is hopefully stay away from it. Don't get it. Let it die out in the community. When these things work and the rate of community spread goes down, then it'll be safe to go back out again. That's going to be a good month at least, and probably more.
Okay, and that's another one of the questions people had is there any suggestion of what the likelihood is of when they would be able to do group rides again? I'm guessing that's kind of difficult to answer.
It is a little difficult to answer. Again, I think that it's gonna depend on where you are and what the spread does in that area. And the thing you want to look at is how many people are hospitalized in your area. It's about 10 to 15% of people that get the virus that get hospitalized. So you can do that math. If there's, like I said, if there's 100 people in the hospital, then there's thousands of people in the community that have it. And as that number goes down, then you can assume the same thing is happening in the community. So that's going to be a few months for sure, at least given our best estimates. Again, I'm in the danger zone of making predictions, so I am probably going to be made to look like a fool with this, but I'd say it's certainly not going to be it's certainly not going to be 2 weeks. It's going to be a couple of months at least. And that's going to be very, very local decision that you have to make based on what's happening in your area.
Awesome. Another question is, if you've been exposed or you've had it, can you get it again?
Okay, so there's a lot of controversy about this. I'll just say that typically with coronaviruses, the answer is no. Once you've gotten it once, you're not going to get it again. These viruses mutate fast, sort of the way they're built. They have a really high rate of changing. So as it gets spread from person to person and replicates more and more, it can change pretty significantly. It doesn't do what flu does. Flu has Influenza has a mechanism where it can every year swap around genes with other influenza viruses. And that's why influenza comes out every year, a slightly different strain that a lot of people can get infected with. My suspicion is that the rate of reinfection with this coronavirus is going to be very, very low, very low. And most of the time, if you've had it and you're cured, then you're not going to get it again. Again, there may be occasional, very rare instances where a strain gets so different that it can start to infect people again. But we didn't see that with SARS. We didn't see that with MERS. And I doubt we'll see it with this one.
Awesome. Another question is there any indication or science around indicating what the possible long-term damage is of the virus for normal, healthy, fit individuals?
Okay, so normal, healthy, fit, young individuals typically very rarely get severe symptoms. So that is usually people that have an underlying lung disease or heart disease. One of the receptors that this thing attaches to is upregulated if you have severe high blood pressure. So we think people that have high blood pressure tend to get severe diseases. And so typically, young, healthy people don't get severe disease. If you do get the severe disease, then a lot of people had significant lung problems for years afterwards, at least looking back at the 2003 SARS epidemic. So if you get severe disease and require hospitalization and you're an athlete, you're probably going to feel it. Now, a lot of those people did get better over time, but we don't particularly know. What I'm a little bit worried about is that, once again, most people don't use, most of their lung capacity. Most people don't do it at all, but the real athletes out there do. They need, if you decrease your lung capacity by a few percentage points, you're going to feel it. And so we don't exactly know. It's one of my reasons I say try your best not to get this virus, because we don't know.
Okay, and then another question is, we've got a couple more. How much does sweet spot training affect your immune system's ability to fight COVID? Like essentially around the level of extenuous exercise they can or shouldn't be doing.
Yeah, so it's hard to make blanket statements, right? Everybody's a little bit different. Mostly, I think people know themselves. If you've been riding for a long time, when I start doing super long endurance rides, and I do that for weeks and weeks and weeks, and I get my training volume up so high, then that's when I tend to get colds and when I tend to get sick. That's not the kind of stuff you want to be doing. If that happens to you when you do a lot of really intense intervals, that's not the kind of stuff you want to be doing here. Again, you want to maintain your immune system as strong as you can for right now. Typically, sweet spot training for right now, for most people doesn't really cause much of that. But again, I'd pay very attention to what your history is, and now's probably a good time to maintain and be reasonable. Does that make sense?
Yep. So another question: if you've been exposed to somebody that has a fever, should you be self-quarantining if it's happened recently?
So we're in a tough time, right? There's way more influenza right now in most communities than there is COVID-19. That's for sure. So if you were exposed to somebody who is at high risk for COVID-19 and had a fever, then I would self-quarantine. If not, it really is going to just be sort of a you've got to figure out where you are on the safety spectrum. Tell you what I would do, which is I would self-quarantine for a bit. After 4 days, if you're not getting symptoms, then you're probably okay. 4 to 7 days. So if you're around somebody that had a cough and a fever, that's what I would do. I would self-quarantine. I know that's probably a little bit more, going on the safety side than not, but we need to get this virus shut down.
And what would be your advice or recommendations for riders with underlying immune conditions?
Stay home.
Fair enough. I believe that is all the questions that we have. Oh, somebody just added one. Oh, they said great webinar. So yeah, I think that's all the questions that we have. I think with that, we will go ahead and close this down. And then if people continue to have questions, as we already mentioned, please feel free to reach out to myself. We're going to plan on having this webinar posted tonight, probably around like 5 o'clock Mountain Time or a little bit before. So yeah, we will get that up, and please know that you can reach out to us. Thank you for being here, and thank you very much, Dr. Roshon, on behalf of all of us for your time.
Thanks, everyone.
All right. Bye, everyone.